Computer, you have my notes. We will begin at the beginning. Call the meeting to order. And we're going to deal with Shauna Dickey's report on the well-being plan, community well-being plan.
Excellent. Thank you,
Am I right?
Councillor Cox, Chair. I'll make some introductory comments. If you just give me a second. First, I'll do the hardest part of the presentation, and that's to make it appear on the screen. Just hit present. There we go. Look at that. We're halfway there. So we're pleased to have an opportunity today to present a progress report on Momentum, Medicine Hat's community well-being plan. Approved in 2025. This plan establishes the priorities and actions that guide our collective efforts to support well-being in our community. Today's presentation outlines the multi-phased process used to develop the plan and highlight the current status of implementation. Community Supports Manager Shauna Dickey is with us to highlight some of the work underway within the city and with our community partners. Her team, which is primarily funded through Family and Community Support Services, focuses on preventative social services. While this work is foundation, Momentum extends beyond social services alone. Its success depends on coordinated efforts and sustained investment from departments across the organization and from partner organizations throughout the city. The progress you'll hear about today reflects those collective efforts. There is more work ahead. There will always be more work ahead as we talk about our community and how circumstances change. But I hope today's update provides clarity on what is currently in progress and what you can expect to see advancing in months and years to come in our community. With that, thank you, Manager Dickey.
Thank you. Thank you for having me here. Thanks for listening to me. So I'll just start. You can go ahead to the next slide. What is Momentum? So it's a 10-year strategy and designed to enhance community well-being, obviously, and it, as Lee said, approach. So that means that this isn't a plan just for the city of Medicine Hat to implement. It is a plan for the community to use in their strategic planning and across the community. So Momentum really defines well-being and then outlines the strategic objectives related to well-being and how we can provide clear action on implementing those objectives. So why did we do this plan? Well, we had a social policy back in 2004, so that was quite old. And then in 2017, Councillor Harlan, you might remember the Thrive Plan. And so that was on a same kind of ongoing initiative strategy for community well-being that started in 2017. A plan was developed, but it wasn't really initiated following the development of the plans. We really wanted to build more on that and ensure that that was initiated in our community. We developed the plan through the advisory committee. So much like Thrive, who had a council of champions, we had a similar advisory committee that drove the development of the plan, including determining the mission and the vision, and existing data should be reviewed because there's lots of data already out there, including Thrive and other pieces of literature. And so they also assisted with the public engagement that advised the plan. And that committee was made up of about 15 to 20 community leaders and internally departments within our city as well. And so just a quick review of the vision of the plan is to Medicine Hat's connected, healthy, and a vibrant community. And the mission is really to ensure that everyone feels safe, economically secure, and have a deep sense of community. Engagement. So as I mentioned, the community well-being plan was an integral part of ensuring that we got proper engagement to advise the plan. So they did a lot of that initial. And then we hosted a community survey on Shape Your City for 2 months and had 274 responses. There was about 17 questions on that survey. And then attendance of open houses or existing open houses and engagement booths to share the plan and to get some feedback as we move through the phases of the plan. And then finally, we did a series of workshops and focus groups that were really where we went to people because we recognized that much of the engagement thus far was very, people had to come to us to provide their. We went to different organizations and gathered that feedback directly from people that we felt that may have been missing. The engagement and assessment of literature, the pillars of well-being are related to foundational aspects of the plan. And if you look at the pillars, you can really see that those are common pillars of well-being and important to contributing to individuals' quality of life. And so these were the pillars that are arching for each one. I think they're pretty straightforward. And so we have a plan, we've done the engagement, we've collected feedback. Now, how do we get to community well-being? From all the feedback and the literature review, we developed some strategic objectives. And there are 9 strategic objectives within the plan and a total of 52 actions that are to achieve those objectives. So 52 is quite a big number, a lot of actions, and then tactical supports to those actions. So we really want the actions to build on existing work, support capacity building, and increase the resilience within our community. To go into the strategic objectives, and I just want to highlight the actions, potential actions in each objective, and then I'll focus on some of the work that's been done to date. Not a comprehensive list at all. There's but in the interest of time and just to kind of highlight some of the important things happening in our community, and there are many, I'll just go through those. Do we want to ask questions at this point about the development of the plan or anything leading up to the plan, or just go straight into
I
the?
think we're good at this point.
I was just gonna say, I was impressed that you had 580 for your focus group and engagement. That's,
We had many, we had like 10 or 12 sessions that we,
yeah,
so
that's
yeah.
a lot.
it was very interesting.
Yeah.
Yeah, the best part of the engagement for sure. Okay, so we'll go into the objectives. So there's 9. Objective 1 is to reduce poverty. As you can see, there's quite a few potential actions in this objective. And these actions really support access to basic needs and the policy that we put in place that could support that could impact poverty. So from affordability, housing strategies, fair rental practices, food security, public services, and access to transportation were kind of the key actions under this objective.
Can I just make a comment on that? This, of all the objectives in the plan, this is the one that in some ways makes me pause and go, is this really an objective for the city of Medicine Hat to reduce poverty? Is that what we're about here? And I, without commenting on that further, that is an interesting one, but it could have overriding implications for other areas, I dare say, of our city administration. One of which comes to mind because we talked about it lately, and that is the city land department and whether or not we want to stay in the land business because we think we can do it more affordably or offer our land at a more affordable cost. And maybe we can't, maybe we shouldn't, but potentially there's an impact there.
Yeah, to the chair, and I would like to just reiterate that this is a plan not just for the city, but for the community. So, and the fact there are many that contribute to this. So, yes, there are things can put in place to help to impact poverty. There's many organizations in our community working to impact poverty in a positive way. So it's not just about us, it's about the entire community and what pieces they may put in place that impact poverty. I think in this Thrive, they talked about ending poverty, and there was quite some ambitious goals there. Yeah, by no means think we're going to end poverty in 10 years, but certainly hoping to have some impact on some of the factors that influence.
Thank you. And that helps me put it in context when you remind me that this isn't just a plan for the city of Medicine. As an organization, it's a plan for the city of Medicine Hat as a whole, as a community. Yeah.
And I was just going to add to that, that it is a collaboration with many groups, much like Thrive was, and the city was part of Thrive as well. So I think this is just sort of a natural continuation of
Yeah.
growing on that. Yeah.
Good. Okay, thanks.
So progress so far on this objective that I wanted to highlight. Again, this is not the whole entire list, but some highlights. So the new residential tax exemption bylaw that promotes development and redevelopment of multi-use residential properties has a huge impact on our rental costs. And we're hoping that we see that impact as these new buildings come about and frees up other spots for people to rent at hopefully a lower rental cost, or at least maintaining the rent where it's at, so that that doesn't continue to increase, because rental cost of living and affordability is a big thing. Also, phase 1 of Medicine Hat Community Housing, which is the photo that's up there, is currently under construction, and so social housing is very much needed in our community, and our waitlist numbers continue to rise, not go down. So we're hoping that this has an impact on that.
Where is this project that's in the photograph?
Yep, this is the Medicine Hat Community Housing Society Affordable Housing up on Kipling, or yeah, this is between Canada Post and the recovery
Through the chair. And it
Okay,
is on property that was donated by the city.
okay, good. Lost track of that one. Must not be driving Kipling Street.
Well, it's kind of set back, so you don't really see it
Yeah.
when you drive. You have to kind of look. I look just to see the program.
Canada Post and the Recovery Center on Cape.
King Cooley.
Oh, right.
Next time you drive down.
I drive by there all the time.
Also, transit improvements have been initiated in this past year. So adaptive transit review and associated actions related to adaptive transit, as well as the implementation of holiday service. That's really important to some of our lower income that need to access jobs or working on the stat holidays. So that is an important improvement and progress. Updated parks bylaw supporting harvesting edible products from plants and trees contributes to food security. And while it might not have a huge impact now, hoping that in the future there's greater potential to have more harvesting.
Does this mean we can go to Police Point and pick choke cherries?
I believe so.
Because that used to be verboten.
You can't, because you're not home.
Anyway.
Make myself home.
Open to anybody. Maybe you could plant some trees. I don't know if that's allowed. Yeah. And then finally, the Rec and Ride program was introduced in the summer of this past year, which was very successful and allowed affordable access for our youth to access transit and recreation programs. So important to connecting our youth to our community. Number 2 objective is enhance community safety. So this is potential actions around education and empowering residents, exploring alternative models to traditional police response, designing physical environments with safety in mind, and working to include, promote inclusion and address some of the stigma that's happening. So the progress thus far on this objective is there's community and provincial level collaboration to combat misinformation, decrease incidents of hate and racism, and foster inclusion for all. So some work being done internally with provincial levels, but also locally. So we have a lot of data related to Medicine Hat. As you can see, the photo in that slide is a sticker that was placed on lamp post down. And we see lots of things like that. So just lots of work towards trying to provide education and awareness and advocacy and places that people can access resources related to hate and discrimination. Medicine Hat Resilient and Inclusive Community Task Force has developed an action plan. So that task force will be working towards that education and awareness and initiatives that can help support a more safe and inclusive downtown. And the Chamber of Commerce also has created a community safety concerns and impact on business webpage that gets some really great information for business owners and residents, things in the community, so that education and awareness piece for this, so people know what's happening. I also recently noted that the Mustard Seed has a 3-year educational and awareness campaign that they just released around complex realities of homelessness and challenging those misconceptions and just trying to deepen the understanding about homelessness. So those are really great progress. And coming up on March 2nd, I think it's going to council on March 2nd, the Downtown Enhancement and Safety Grant. So helping those downtown businesses create greater safety by design. Objective 3 is to promote health and wellness. So this is around physical literacy, transportation, active transportation, mental health and addiction, recruitment and healthcare, advocating for senior support programs. And it's not our purview, but there are things that we can do as a city and as a community to support and promote health and wellness. And there is lots that's happening to date. So far, collaborative project for the development and promotion of community play spaces and programming for families. So Parks and Rec is very involved in partnering with different organizations to support those active play spaces for our families and for our children, and promote that physical literacy for families. Also developing, promoting, and advocating for evidence-based local community support programs that support older adults who want to stay and remain in their homes. So there is a number of pilot projects right now looking at support for aging adults. We have an aging community and lots of things that and support them to stay safer in their home longer. And finally, Medicine Hat Health Communities collaboration. So there are a number of different collaborations. This is just one of them that helps residents make meaningful connections and build resilience. This committee works together to create events and initiatives that help people to create a better sense of belonging and inclusion in our community.
If I could just ask a question regarding recruitment of healthcare professionals. I know City of Medicine Hat was actively engaged in that at some point in the past when I was previously on council, together with, I guess, Alberta Healthcare. But in any event, we were wining and dining doctors and their spouses and trying to interest them in living in Medicine Hat and locating here. Is there a program of that kind going on now?
Through the chair, there's not a piece that I'm that Public Services Division is connected to at this point. I do recall the efforts that you spoke of in the past. The chamber was well connected with that, as well as I think the PCN. Certainly, we see the impact of that on our residents, and that could be a piece under the community wellbeing plan.
Yeah, and if I can speak to the chair, I know that the Health Foundation had connected with them regarding this that particular objective, and there is lots of work happening in different pockets. Like I know that there's local realtors that will engage with doctors and show them around, and like so informal stuff happening, but also lots of stuff through ACDEV to look at, how do we recruit and retain. Lots of work in healthcare, obviously, but yeah, there's lots of little pieces of things happening.
Thank you.
Objective 4 is support lifelong learning for all residents. So building connections with educational institutes so we can all work together towards that. Youth supports and especially workforce and employment needs is a big need right now. Promoting individual capacity building and learning, different learning opportunities for different people depending on how they need to learn. And then promoting intergenerational learning, which we know supports youth and aging adults alike. So the progress thus far on this objective is there is a youth-friendly assets. There is a group, a regular group that connects together and works on looking at what youth-friendly assets are in our community and how we can collaborate and build and strengthen that. So community of practice type collaboration. And expanding the array of learning services outside of tailored learning models and ensuring documents are readable. So we have a project around expanding the array of learning opportunities through pathways at the college, looking at ways that people take in information and ensuring it's readable and accessible to all. We also have an existing intergenerational program evaluation happening. So someone is looking at existing intergenerational programming in the community, what are service gaps, what is actually happening, because lots of times we have lots of things happening, but people don't know what they all are. So just kind of doing an assessment of what that is and how we can build on those intergenerational programs. That's a photo in the slide is of our Cyber Seniors program that we had at the Viner Center a few years ago, which was a very successful program for intergenerational learning. And then finally, the Pay Lakes Foundation is doing a lot of work in our community. We're one of the pilot projects for the resiliency framework, which I think you guys have a presentation coming up for the Pay Lakes Foundation. So this is really great opportunity to reframe our public's assumptions about complex social issues and including how resiliency is built. So that's a really positive thing to be happening. And I know there is also a series of educational series happening in March around educating our community around resiliency and what that looks like to try to reframe some of that thinking and assumptions. Objective 5, create and enhance economic opportunities. So these are things really focused more around the work that HECTA is doing and overlaps quite a bit with their economic development plan. So supporting our workforce and interest, attracting investment and supporting social enterprise and equity deserving entrepreneurs is what this objective is focused on. Progress so far, human resource professional workshop series around workforce sustainability, and the key focus is on diversifying the workforce for continuity. We also have the addition of town square parking program, which just allows more people to get downtown, access the businesses down there, as well as the new residential tax exemption bylaw, which I mentioned before, but also has a big impact on getting people here. The more affordable we are, the more places we have for people to live. You know, one of the things in the objective was talking about being ready for investment and growth. And so, you know, as we get people here, we need supports and services in place to support them when they're here. And then finally, the City Center Vibrancy Program. So the GRAP program that helps property improvements to add to the vibrancy, sustainability, and livability of the city center. Objective 6 is embrace and celebrate the diversity of Medicine Hat. So this is around inclusive city spaces and designing things alongside addressing accessibility barriers in city spaces, developing a city Medicine Hat inclusive policy and framework, and doing inclusive community designation. As many of you are aware, we are hosting the Summer Olympics or the Special Olympics this summer. And the progress towards that is that audit of those spaces to ensure that they support all the needs of the games and all the people that will be coming here to participate. Also, the committee, there is a committee convening to evaluate Medicine Hat age-friendly capacity. So taking into account not just our aging needs, but also the needs of everyone across the lifespan. So just looking at where do we land on that age-friendly and what should we be doing to work towards more age-friendly community. Objective 7 is take meaningful action towards reconciliation. So this is around truth and reconciliation, education and training for city staff, relationships with Indigenous peoples, engaging on matters important to them, and also celebrating their histories and culture. have lots of great things happening on this objective. In case you weren't aware, we have hired a new Indigenous Relations Coordinator with the City of Medicine Hat. She started in October of last year. She's been working quite a bit to look at some internal training opportunities for Indigenous community, cultural humility and understanding of our local in First Nations, Métis, and Inuit residents. There has also been a great project that communications, engagement, and marketing had a big piece in engagement with our Indigenous community around the resurfacing of the floor of the teepee. So that is still a bit ongoing. I think there's still some pieces, but it was a really big piece of engagement with our Indigenous community. It really. And then finally, around arts and culture, as a documentary series that we helped host, Mike Mountain Horse Story Road.
What is that exactly?
You want to answer that?
So this is an artifact that's in the City of Medicine Hat collection, and it's a story robe done in the early 20th century by Mike Mountainhorse. It's essentially a pictograph of his actions during the First World War. So it's a traditional form of documentation. It's quite rare that we would have this, and it's preserved quite well in our museum. This object has traveled all over the world and been exhibited in major museums. It was just at the LA County Museum, and the BBC actually flew a crew over to do probably about an 8-minute segment on this artifact, because it's the story of Indigenous folks, but it's also the story of colonization in the Second World War. So it's a very important artifact.
And so there's going to be a documentary prepared.
It's already aired on BBC Three. Yeah, that's correct.
Sorry.
We'll share that link with you.
Yeah.
Excellent. I would like that.
Yeah, it's called the Empire series.
So, and this artifact is back in or remains in our collection,
Correct. Yes. Yeah.
but is not generally on display.
It's we've displayed it here. We do loan it out to other institutions as well. So currently it's not on display.
It's a much better job than I would want that. Okay, 2 more left. Objective 8, empower residents to be engaged participants in the community. One of my favorite objectives, I would say. It potential actions to encourage civic participation, engagement, incorporate inclusive advocacy and program development, strengthen volunteerism across our city, and expand opportunities for neighborhood engagement. So some of the work that's happening in the progress right now, we're almost done a volunteer engagement learning series that started in the winter and is going into next week is the final session. So working with Volunteer Alberta to highlight some recruitment, retention, and recognition of volunteers. And this is the engagement series open to agencies, any agency that supports volunteers, which there are many, and almost every agency that requires and uses volunteers. We don't have a volunteer hub, so this has become pretty important in our community over the last 15 years. And then in relation to that, they're planning a volunteer fair and some activities around volunteer work, which I believe, or volunteer week, which is in April. Neighborhood Association Society has expanded from expanding opportunities for neighborhood engagement. So in 2025, we actually had 0 neighborhood associations active. They had a few in the past and they had folded. And the Neighborhood Association Society was able to activate 5 existing neighborhood associations in our community and 5 to 6 currently developing. So we're forward to seeing how that develops. And finally, civic engagement. So
Private question.
yeah.
Do we do much to let people know that they should form a community organization?
That group is very active. They have lots of volunteer engagement. They have lots of sessions in neighborhoods where they get people to come and just answer questions and talk about neighborhood associations and what it involves. And the Neighborhood Association Society is actually the backbone financial. So they can apply for grants for neighborhood associations. So they really have done a lot of work to support neighborhood associations, which you can tell from having so many new ones and so many wanting to come on.
Yeah, because when we were doing the rezoning, what was the name of that family? The Hale?
The Hales and.
The Hale. So the Hales in Harlow, they are all, there's 12 of them that all live together, but they
Yeah.
didn't know that they could form an association.
Oh, they're very aware.
Are
well,
they
right
now?
They have, they have a neighborhood association.
Good for them.
Harlow. Yeah,
Okay.
yeah, and you have worked quite extensively with that. It's been very positive.
And so the Neighborhood Associations Society, there's actually an incorporated group that promotes the formation of neighborhood associations
That's correct.
in Medicine Hat.
That's correct.
Are we responsible for getting that going? Or
Yeah.
is that?
Yes, actually, a member of my team is the chair of the group and has done an extensive amount of work to get that going, to get that together. She has a committee, obviously, the board for the society that all work together. There's another member of our city within the city of Medicine Hat that's part of that. So yeah, have lots of contributions to that.
So basically, the idea here is the city of Medicine Hat has planted the seed, got a group going. One of our own staff remains as the current chair, but we're looking kind of have
Yeah.
this move outside of City Hall completely.
Well, it's about building capacity, right? So neighborhood associations were really kind of only part. There was nothing to kind of glue to hold them together, or that financial piece to get them funding and get them moving and get them aware of what neighborhood associations is about. So yeah, it's about building that capacity. So eventually they'll be more robust, things will be in place, and then it doesn't have to be us leading it all the time.
Does the funding come from the province or from the city for?
Wherever they apply for funding. So I believe they got some money from Community Foundation, Impact Award funding, I believe. So yeah, it gives them the ability to fundraise or to look at funding sources for different activities.
Good.
And so the civic engagement for New Canadians. So prior to the election in October, the community said, we have lots of newcomers who don't really know the process and what's happening. It was a bit last minute, but they threw kind of something together, but it was really great. We had lots of participants come and learn about voting, learn about the election, learn about what Canadian politics. And so that was a really positive progress. Also looking at potential of doing something similar for the Stats Canada census that's coming up, because if you're not used to people coming to your door or getting this sheet of paper saying, fill this out, all this information about yourself, it can be challenging for people. So just trying to provide some education and awareness for newcomers around that. And then finally, last objective is to enhance organizational efforts to support well-being. So this objective is really mostly aligned with internally with how we clarify and communicate our roles. So we talked about not all of this stuff is our role, but how can we convene or advocate or build capacity within our community around some of these things, and kind of taking the lead in that. Supporting community systems approach, so ensuring we're looking at that prevention focus and how our systems come into place to prevent some movement on the objectives. Also to be bold advocates, to advocate to the province and to the federal government and wherever else we need to around issues in our community that feel need support, and making sure that we're including multiple inputs into decision making. So especially when it's issues that impact people, are they involved in that decision, and how does that look like? And then the final two that I highlighted are aligning resources with community wellbeing needs. So that's one of the things that we certainly looked at as a team and across the community is how can we make traction and make progress on this report so it's not just sitting there and that we're actually progressing. How do we align our resources to make sure that the objectives are met? And then how do we track that progress? So that's a big piece of work. Working on there is been developed a dashboard. So for the city's website where people can go and say, okay, here's objective 1 and what has been happening. So a lot of the highlights that I've provided today and additional highlights will be available to the public to see on the website so they can track our progress as we go. And just wanted to highlight throughout the development of the community wellbeing plan, there was a number of reports that were created through the research, understanding wellbeing in Medicine Hat. So that research report is available online. What we learned through the engagement, there's a report on all the levels of engagement and the more intimate details of that engagement. And then also the full plan and the summary of the plan. So the full plan is quite big. So if you just want to grab a summary of the plan, it's a little more accessible. That is available. All of these reports are available on the Shape Your City website for the community wellbeing plan. And we're hoping to eventually have a website dedicated to this so we can have our dashboard and all the related plans on the website, easy to find.
Very interesting, very complete, and question arises, do we recommend that this?
I think so. I think if you want to present it to
Oh, I
council.
love presenting to council.
Yeah, I think this encompasses a lot of stuff like what Thrive was before. I think Thrive had 13 objectives and I think, does that sound right?
Yeah, I just looked them over and there was quite a few. They've broken out more of their objectives.
Yes.
More broken out than ours.
Yeah, yours
Yeah.
are, yeah, this is all the same stuff.
Yeah, very similar. Yeah.
Yeah, and I think that was good for the community to know about that. Thrive struggled at the start of COVID. They struggled with funding. So we didn't have any money to continue to pay our executive director and we could pursue funding, but at the start of COVID, we didn't want to compete with the actual service providers in town, like the food bank and whoever else. So we just kind of shelved it and it never got going again. But this is great. And I think the city leading the charge on this is going to make a big difference because it's not going to just flicker out, right? It's going to keep going. But I think this would be a good thing to present to council.
She did.
Okay, then that's what we'll do.
We would appreciate the opportunity to. We can certainly condense it a little bit, understanding that council meetings can be quite busy. But we're really excited to celebrate some of the great work that's being done.
Then that's
Thank you for the presentation.
recommendation.
Okay, thank you.
Thank you.
Thank you, Shauna.
Thank you.
Right. Isn't that fire and emergency service? With the fire service here with us this afternoon.
Actually, the room smelled like smoke.
You'll see your presentation, or no, it's a verbal presentation.
Yeah, absolutely. So Chief Higgins is here with us to present the annual report today. The report is attached to the package. It's provided annually to highlight some of the services and work and performance of the Medicine Hat Fire and Emergency Services. Report is filled with interesting information. So if you or anybody in the public hasn't had a chance to flip through it, I would encourage you. It's attractive, it's useful, and it highlights all of the great work that team does. So certainly, Chief Higgins, if you would speak to the report, that would be appreciated.
Through the chair, good afternoon, chair and members of the committee. Thanks for the opportunity to provide the highlights from our 2025 year in review. 25 was a strong year, service delivery, modernization, and community engagement. Our team remains focused on providing reliable emergency response, proactive prevention, and public safety services to approximately 68,700 residents across our community. Throughout 2025, Fire and Emergency Services responded to 5,128 total incidents, including 2,584 emergency incidents. These calls reflect the evolving demand placed on emergency services, include fires, medical emergencies, hazardous materials incidents, technical rescues, and motor vehicle collisions. From a performance perspective, our crews maintained a strong response time. Our first arriving engines reached priority emergencies in 6 minutes and 18 seconds on 1,394 red incidents. So meeting council's approved targets. Early response is critical as it significantly improves life safety and responder safety outcomes, fire containment, and property conservation. To provide a greater understanding and background of the 6 minutes and 20-second response time, we aim to have first arriving engine within 6 minutes and 20 seconds to 90% of the incidents. And we also aim to have what we call a full alarm assignment, which is all 3 of our stations in 12 minutes and 20 seconds. These response time targets were adopted by council in January of 2013. And are grounded in NFPA standards, occupant tenability, and fire conditions, and the anticipated time to structural floor collapse when exposed to fire. So those are all the conditions that we consider when we talk about response times, and you'll hear me talk about them probably a number of times. But I think what's important to note there is those response times when fire goes every 30 seconds is a significant service to the residents of the community. And where you'll see the differences from here to Calgary is we're talking about the fire emergent, where the city of Calgary is talking about the exposures on each side of that. And so we do a really good job of containing that to the resident of origin. So firefighters also continue to play a vital role in medical co-response. Crews regularly provide early life-saving interventions such as CPR, defibrillation, airway management, and scene stabilization, supporting improved patient outcomes and strengthening partnerships with which is now called Emergency Health Services, formerly Alberta Health Services.
Can I just ask a question?
Absolutely.
Are we co-responding with paramedics, with the ambulance?
Correct.
There was a time when we did that.
Yeah, so to the chair, we certainly are. We define the level of service in regards to medical calls are graded from Alpha to Delta, and so to Echo, sorry, and we're doing the Delta and Echo. So we were doing the most critical ones where they need the help. So if it's generally, like I said, heart attack, CPR, those types of things where the intervention is necessary now. And so we think that's a real positive for the community, and our residents want that type of service. Certainly when EHS isn't available, one of our units will respond if EHS is in what they call a code red and have no ambulance is available. We'll take all of those at that point, but our first service provided is at the highest level.
Carry on.
Oh, I just want to make sure. Okay. From a financial stewardship perspective, the department operated an approved budget of approximately $19 million, with 92% of that budget supporting frontline staffing and operational readiness. Our work continues to demonstrate strong value for the community. 25 fire incidents involved approximately $34.4 million in property value. Through rapid response and coordinated operations, crews successfully protecting nearly 89% of property at risk, representing more than $30 million saved. Prevention remains a cornerstone of our service delivery. Our frontline suppression staff completed more than 2,100 life safety checks, and our community safety staff completed more than 200 inspections, helping ensure compliance with provincial codes and reducing risk before emergencies occur. Our team also conducted 78 fire investigations, which support prevention strategies and guide future education initiatives. On page 15 of the report, you'll find the top 5 causes of fire in 2025 and the top 5 most frequent violations found in our life safety checks and inspections. Public education programming continues to expand. During 25, we delivered fire and life safety education to more than 6,000 residents. These initiatives included school programming, senior safety education, youth fire intervention, and neighborhood outreach following fire incidents. These programs help reduce risk and strengthen community resilience. Another great tool for sharing safety initiatives, public education, and timely information about incidents is our social media accounts. On page 26 of the report, you'll see this area we had a significant increase in our presence through 25, with our Facebook views up 317% over 2024, and our Instagram views was up, excuse me, over 473% over 2024. So we put some significant work into getting some of that information into the public through those social media feeds. Also, our 911 communications branch has remained extremely busy, processing more than 121,000 incoming calls, supporting emergency response and municipal services across Medicine Hat and surrounding communities. One of the most significant initiatives underway is the implementation of our next gen 911. This modernization will enhance system reliability, improve color, location accuracy, and allow for future capabilities such as text and multimedia emergency reporting. This investment strengthens public access to emergency services and supports faster and more informed decision-making for responders. We also continued upgrading frontline technology, including replacing mobile data computers in our frontline fire apparatus and implementing a new records management software to improve reporting and accuracy and operational coordination. The success continues to be built on the professionalism and dedication of our people. This dedication is demonstrated on page 9 of the report, where we celebrated 15 staff members in 25 with years of service and recognition ranging from 10 to 35 years. We have a very committed staff in fire services. We also had the honor of presenting 20 staff with service medals, both Alberta and Canadian, for 12, 20, and 22 years. So in 25, the department maintained approximately 116 personnel across suppression, communications, prevention, training, and support services. Training remains a major priority. During the year, the members completed more than 17,000 hours of operational, technical, and leadership training. This ensures our personnel are prepared to respond safely and effectively to both routine and complex emergencies. We also continue to strengthen specialized response capabilities, including surface, water, and ice rescue, hazardous materials response, and technical rescue operations, allowing us to respond effectively to unique risks that our community presents. Supporting member health and wellness remains essential for us. Emergency responders are regularly exposed to high stress and traumatic situations, making proactive wellness supports critical. In 25, we expanded our peer support programming, continued critical incident stress management services, and enhanced medical and fitness assessment programs. We also onboarded our second fire service chaplain, expanding emotional and family support services available both to the members and the residents impacted by emergencies. So that's a key point. Our bringing on a second chaplain has really helped with providing that service to our residents. They do ride-alongs with us, and they are on a call-out schedule. And so when someone has lost everything, as you can imagine, during a house fire, we bring in our chaplain, and they certainly help that family through that time and help support, get the support and services that they need. So it's critical, internal and both internal and external. So yeah, community partnerships remain central to our success. Throughout 25, we continued working closely with municipal departments, public safety agencies, and social service organizations. These partnerships are especially important when addressing encampment safety, housing vulnerability, and community wellness challenges. Our approach focuses on balancing public safety with compassion while helping connect vulnerable individuals to support services. While 2025 included many successes, we continue to monitor several emerging challenges. These include increasing emergency calls related to opioid overdoses, growing fire risks associated with lithium-ion batteries, and increased service demand related to vacant structures and encampments. Operational pressures such as inflation and supply chain delays also continue to impact fleet replacement timelines and specialized equipment procurement. These challenges require ongoing strategic planning to ensure sustainable service delivery. Looking ahead, our priorities include expanding targeted prevention and public education program, completing the next gen 911 and modern records management system, strengthening our regional partnerships, expanding mental health and wellness supports, and finally enhancing data-driven planning to support long-term service sustainability. 2025, as I think everyone is aware, also marked an important milestone as we celebrated 125 years of service in Medicine Hat. This anniversary provided an opportunity for us to reflect on our history, for reaffirming our commitment to innovation, professionalism, and community service. Closing, I want to recognize the dedication and professionalism of our team. Their commitment ensures that our community remains safe, resilient, and well supported. Thanks for the time, and I'll take any questions.
Any questions? Good day.
So tomorrow, my apartment building is having our fire safety exam. So that's good. And I'm not sure if, I'm sure you know this, but 9 months ago, and I have to look it up because I want to make sure I get the name of the gentleman who was there with us. So 9 months ago, fire and safety educator, Kelly Ireland and Grayson Smith, fire prevention officer, came to my apartment because my smoke detector was beeping nonstop. And most of the time that's because the battery is false. But these are ones that are hardwired into the building, but yet it continued to beep. And the landlord would do nothing about it. It just continued to beep. And so Kelly and Grayson came and we did a story for television about what you do in that situation. And so on my Facebook page, that video, and I usually get between 500 and 600 people who like them or watch them. That video has only 125 people, but I did a follow-up one once the smoke detector was working again and talking with people about smoke detectors and making sure how important it is they're working. And that one has gotten almost 4,000 views. So I was inspired to do that by talking with your people, and everywhere I go in the community, I see Kelly and Grayson and your members out there. So you guys do a tremendous job in keeping the word out there about changing batteries and smoke detectors and everything. And I also want to say thank you on behalf of the councillors who were at the 125th anniversary for including that great picture of them in your presentation. So nice to see some people who have never fought a fire in their life in your presentation. So thank you.
You don't know I never fought fire.
That's true. That's true. What Chris does in his spare time, I don't always know. But congratulations to you and your team and continued good work.
Yeah, thanks. I appreciate the comments and answers. Really passed it to the team.
I just have a question from page 28 in the slides. Just at the bottom right there, 1 in 3 MFR cardiac arrests were drug related. What's MFR?
Medical first response.
So that's just in general, 1 in 3 of every call for cardiac arrest that went out, 1 in 3 was drug related.
Yes.
Holy cow.
So when we, through the chair, sorry, when we do medical first response, we have to do a patient care report. And so we do track whether it was drug related or not. And so, yes, that's what that definitely represents that.
Wow. Is there a specific type of drug or is that tracked?
That is not tracked.
Okay.
And you should be careful when you suggest that we haven't fought fires. I actually worked alongside a couple of firemen. This is a few years ago, and I was having a little fall bonfire in my backyard. And the fire department responded and said, maybe we should help you put that out. So we worked together and extinguished the little fire going on in my backyard.
One could say as city councillors, we're always putting out fires.
True. A couple of questions, Chief Eakings. I noted fire investigation, top 5 causes of fire, page 15. Are those in any particular order? Arson is the first one on the list. Undetermined, careless smoking, science-related, lithium-ion battery related.
I'm not, through the chair, I'm not clear on the particular order, but certainly arson has caught the attention. This isn't the first time I've been asked the question, but I did a little digging after admin committee, to be honest with you. And yeah, arson, because some of them appear as arson. Certainly there is some connection to the opioid crisis and there's some connection to our unhoused individuals. So that's what's driving that number.
Okay. So we're not necessarily,
It's not one individual.
not convenient fires. Yeah, okay, I got
It's
you.
some of those behaviors that are leading to those. And
Yeah.
so, yeah, we don't have like a single arsonist in the city that.
No, or a reef of deliberately set fires for fraudulent purposes, so
Yeah.
to speak. Okay, that makes me feel a little more comfortable. I had a second question, but I don't remember what it was now. So just pretend I didn't have it. Okay. Thank you, Chief Eakins.
Thank
This will go on to council, but as part of the consent agenda. Wondering if we should have someone there to answer questions if there are any. Is that an option?
Perhaps virtually
Yeah.
or in person.
Okay.
To see what they're into.
Because, yeah, there's quite a bit in this report and there may be questions from council. And, yeah, okay, let's just make that, virtually, if not in person. Okay, thank you. All right. Managing Director's Service Area Update.
I do have one to share with you today. I will ask Acting Director Nelson to give an update on the holiday transit service.
Thank you, Lee. And through the chair. So the Stat Holiday pilot, the first one ran on last week on Monday on Family Day. We offered the Sunday service for that day. So that's 7:15 a.m. to 8:45 p.m. Same levels as we do regular Sundays. And the ridership was slightly more than half the ridership of a regular Sunday. A couple learnings from that one is more direct communication with ridership in general. So that would be more posters on shelters, more communication on the buses themselves. We did have a slight software glitch for 2 hours in the morning. It was a scheduling piece for on demand. So we've identified that and corrected that. The next holiday service will be on Wednesday, July 1st. So it's important to note that that's the middle of the week. And that was the number one choice of people when we did the surveys. We will offer the same level of service, the Sunday level service. And depending on the results of that, aggregated with the Family Day service, will determine what the next holiday will be in the fall. And that's a choice between Truth and Reconciliation Day. Good Unicorn. But lower than the average.
What's that?
When you say lower, like substantially lower or,
Slightly more than half of the usual Sunday ridership.
and Sunday is normally the lowest used
Correct, yeah.
day?
And that's aggregated over.
Typically what we see, if I may through the chair, is Monday to Friday ridership is like this. Saturday drops, Sunday drops fairly significantly, and this would have been half of that in terms of ridership levels.
I thought the city did a very good job of letting people know that it was going to be available. So, yeah, I could see more for next time, but sure.
It's a pilot, so it's difficult to change people's habits. So yeah, some learnings, definitely.
Yeah, I think you're indicating that there'll be broader efforts to try and alert the users of the system that this is going to be available and to make, if they wish to avail themselves of it. So I think that's important. Those are the people that are most likely to use it. So putting notices on bus shelters or in the buses themselves, just to get that word out. Sounds like a good plan. All right, thank you very much. Action items, downtown safety enhancement is one of those action items that we are gonna.
That's correct. So that item came to the last Public Services Committee meeting and will go to council next week. So with your confirmation, we'll remove that from our action item list now that Public Services Committee has addressed that.
Okay. council will get this in open
Monday,
on Monday.
correct.
This Monday?
That'll be March.
This Monday,
March 2nd.
March 2nd.
Yes.
Yeah. Okay, thank you. And a second action item.
So that's the mustard seed update, which sits on our action item list so that we would bring back updates as we have them. We don't have an update for this meeting.
Okay.
So we'll leave it there.
Questions on that? Questions on this? Okay. That's our open agenda. So the media present,
Yes, there is.
they are present online. I'm sorry. Welcome.
Hey, Brendan.
Hard to tell who's who down there. All right, well, then we'll entertain a motion to close the meeting to the public. Oh, Dan, thank you. And we're in agreement with that.
We're in agreement.
There we go. We're enclosed. Thank you. Are there any questions from the media before we shut you out? No, okay.
Brendan, got any questions before we lock you up, brother?
He's asleep at the switch. All right,